What causes elevated FSH levels in women? Have you ever wondered what elevated follicle-stimulating hormone levels mean for women? Elevated FSH levels can be a key indicator of various reproductive health issues, especially concerning fertility. FSH is a hormone produced by the pituitary gland, and its main job is to stimulate the growth of ovarian follicles, which contain eggs. Let's explore the causes of elevated FSH levels and what they signify for women's health. First, let's understand the function of FSH. It plays a vital role in the menstrual cycle by promoting the growth of ovarian follicles. In a typical cycle, FSH levels rise to encourage follicular growth. As estrogen levels increase, FSH levels decrease, signaling that an egg will be released during ovulation. Normal FSH levels can vary throughout the menstrual cycle but are generally higher during the follicular phase. When FSH levels are abnormally high, it can indicate problems with ovarian function. One major cause of elevated FSH levels is premature ovarian failure, also known as premature ovarian insufficiency. This condition occurs when the ovaries stop functioning before the age of 40. In this case, the ovaries do not respond to FSH, which leads to higher production levels of the hormone. Another common cause is menopause. As women approach menopause, their ovaries gradually stop producing eggs. This leads to increased FSH levels as the body attempts to stimulate the ovaries to produce eggs. Polycystic Ovary Syndrome, or PCOS, is another condition that can affect hormone levels. While PCOS is more commonly linked to insulin resistance and androgen excess, it can sometimes present with irregular hormone levels, including FSH. However, it is not typically associated with high FSH levels. Ovarian damage from surgery, infection, or chemotherapy can also lead to elevated FSH levels. Such damage reduces ovarian function, resulting in higher FSH production. Lastly, certain genetic factors can impact ovarian function, leading to elevated FSH levels. These genetic conditions can affect how the body produces and responds to hormones. Elevated FSH levels are often used in fertility testing as an indicator of diminished ovarian reserve. Women with high FSH levels may be advised to consider fertility treatment sooner rather than later. Additionally, while endometriosis does not directly cause elevated FSH levels, it can contribute to infertility. Women with endometriosis may undergo fertility testing, including assessments of FSH levels, to evaluate their ovarian function. In summary, elevated FSH levels in women are primarily linked to issues with ovarian function and reserve. Understanding these causes is essential for addressing fertility concerns and managing conditions like premature ovarian failure. For personalized advice, it is crucial to consult a healthcare provider who can offer tailored guidance based on individual health needs.